Yep.
We are now live.
Good evening, Santa Rosa City Schools community. My name is Anna Trinnell. I am the superintendent of the district, and we want to welcome you to tonight's forum. We have several panelists with us tonight, and I'm going to take a moment to introduce our executive team, and then they will, if they have a member of their team present, they will take a chance to introduce them. So I'd like to start with our Deputy Superintendent, Rick Edson.
Good evening, everyone. Rick Edson, Deputy Superintendent. I'd also like to introduce Rand Van Dyke, Director of Data Testing and Assessment, and Ed Burke, Director of Child Nutrition Services.
Thank you, Rick. I'd like to introduce Dr. Kimberly Armstrong, our Associate Superintendent of Educational Services.
Good evening. I'd like to introduce Director Eduiha Lamas, Executive Director Tim Zolinardo, Executive Director Kelly Dillon, and Executive Director Steve Mazzara.
Thank you. And I'd like to introduce Mike Shepard, our Assistant Superintendent of Human Resources.
Good evening. And I'd like to introduce our Director of Safety and Risk Management, Patty Turner.
Carson, don't shut the door.
Very good. Thank
Don't
you
shut the
so
door.
much. We also have interpreters on the line tonight. If you could unmute and introduce yourself.
Buenas tardes, habla María Aguirre, soy
Gotta pay attention
intérprete
first.
para las personas que necesiten de interpretación, por favor.
Okay, thank you. And then later this evening, we will be joined by 4 physicians who are in our community. Dr. Brian Pratowski, who's a doctor at who is a Sutter pediatrician, Dr. Douglas Jimenez, who is a Santa Rosa Community Health Family Physician, Dr. Devon Jackson, who is a Santa Rosa Community Health Family Physician, and Dr. Meredith Kieschnick, who is a Roseland Pediatric Clinic Physician. We're going to get our evening started tonight with a commitment to everyone in our community that we remain student-centered and student-focused. We are excited to welcome our students back to school, full-time, in-person, 5 days a week, and we look forward to starting that on August 12th. Social emotional learning and mental health are going to continue to be a focus for us so that we can continue to provide support to our students and our staff. We are working on updates such as AB 130 around independent study and what that means for our board policies. And after tonight's event, we will continue to create a frequently asked questions document or an FAQ so that we can capture the great questions that you're going to ask tonight and that we can be responsive to you. We have lots of information to share with you, and each division or department will take turns sharing some information as it relates to return to school plans. We're going to start tonight with our educational services team, and I will hand it over to Dr. Armstrong.
Thank you. Good evening. As mentioned, my name is Dr. Armstrong, and I'm serving as Associate Superintendent of Ed Services. And I'm new this year, and I just want to take the opportunity to say that I look forward to opportunities to connect and engage with the SRCS community. A few members of the Ed Services leadership team are joining me in sharing important information this evening. I'd like to emphasize Assembly Bill 104. It's also referred to as AB 104. And AB 104 permits parents of students who were in high school during the 2021 school year or students who are 18 and over to request letter grades from last year to be changed to pass, no pass on transcripts. So if a student earned an F, as an example, that grade can be changed to no pass. A no pass is not calculated in the grade point average. So if a student earned a passing grade, let's say, for example, a D, a student can request a pass and the D mark will no longer be calculated in the grade point average. Pass and or no pass are not calculated in the grade point average. There is a form that went out, and we will make sure that's on our website that you can access, but we're also making sure that every family has access with technology not being a barrier. So we'll be doing a mailer this coming week as well, and forms that students can take and return to school when schools open. What's really key is that the form is due Monday, August 16th. So the Assembly bill only allowed for a 15-day collection period, and then we have another 15 days to change the grade. So Assembly Bill 104, please put that on your radar. I'd like to now pass it to Executive Director Zalinardo to discuss Assembly Bill 130.
Thank you very much, Dr. Armstrong. I appreciate it. And so good evening, Santa Rosa City Schools community. We are overjoyed to be with you tonight, and I will be glad to share with you a little information about AB, our Assembly Bill 130. It was an Assembly bill that was passed by our California legislature, and legal consulting and other services provided to school districts helped with a summary of its key aspects for school districts later in July. And we refer to that as AB 130. It covered multiple items. And in it had a very important one, which was the fact that families who have concern about health compromised students or about their student being compromised with their health, that they're allowed to enroll their student in independent study as a means of not having that student attend in-person schooling if they believe that in-person schooling poses a great risk. Along with many school districts and our county schools, Santa Rosa City Schools is carefully considering how to make sure we can serve our community and our students and families best in responding to AB 130. It comes with it tonight with the ability in this presentation for you to know kind of how to find a little more information, because you'll hear a lot tonight. And you might want to go and read a little bit more, and you might want to see some of what we have on our website. So at our website itself at Santa Rosa City Schools, we have a little bit of information you can refer to. And I'll say it more than once, but it's srcsschools.org. And then it's a /AB 130. So once again, that's srcsschools.org /AB 130. And on there, you can read a little bit in case you miss some of what I say. And you'll see on there that there's also a form for parents or guardians that is an interest form and allows families to indicate if an independent study placement is something of interest. We want to let you know if you look at the information and you're a little unsure. Of course, when we return in person, our staff will gladly meet with students and families to support them and guide them with advice and have a chance to analyze and think through the options if it's something that the family does not want to decide before we come back to in-person schooling. And finally, once again, that form is on our website, srcsschools.org, AB 130. And just know that we look forward to supporting your student as we all respond still to an ongoing pandemic. There are still things changing, and we're going to be there to make sure we help provide you the best situation for learning that we can. So thanks for being with us tonight, and please feel free to look at the web information. I'll turn it back to Dr. Armstrong. Sorry, I muted myself too quickly.
Yeah, no problem. Up next is Kelly Dillon.
Good evening. Nice to be here with you all. My name is Kelly Dillon, Executive Director in Ed Services. And I just wanted to check in and welcome and speak a little bit to a welcoming of our Kinder Academy and kindergarten students this year. We are excited to welcome all our students, but our Kinder Academy and kindergarten students do hold a special place in our hearts, as this is their start of their educational experience with us. And we understand that this is an important transition in the lives of our students and families, and want to provide them a welcome and supportive entrance into school for the first time. I can say because I work with them very closely, that we have an amazing group of kindergarten and kinder academy teachers who love teaching our youngest students and collaborate with one another to share ideas and strategies to support and provide a caring environment for our students that helps them learn how to be a student and how to be in school while gaining the foundational skills. And we know that for parents and students, this can be both exciting moment, but also can be might be a little nervous to start the school year for the very first time. We just want to make you aware that in order to support the transition, our elementary school sites are providing a variety of ways to connect with students, each having their unique way of doing so, but this may include in-person and or virtual meet and greets, roster reveal parties, kindergarten screening and one-on-one meetings with parents, as well as other kinds of communication home. So we just want to make you aware of that. If you are a parent of a kinder academy or kindergarten student, that we do have plans to welcome your child into our school district and to be on the lookout for messages via Parent Square and or email informing you of these opportunities. And of course, if you feel like you're missing a communication or haven't received something in the next few days, do feel very free to reach out to your school with any questions. I'll turn it back to you, Dr. Armstrong.
Oh, okay, perfect. And then I'll turn it over to Director Eduijas Lamas.
Good afternoon, good evening, everyone. Buenas tardes. I just wanted to really remind folks, our families, just let them know that we are committed, and we will ensure that as our students return back to school full-time, our English learners, that every student will be receiving the designated English language development instruction that needs to be happening, as well as integrated. For that, we have a team of certificated teachers and some counselors and our English language learner TOSA that will be working collaboratively with all of our school sites to really ensure that those services are up and running. We will definitely be gearing up with this new program that that is called Elevation, that will be able to give us live data for the sites, for every single one of our teachers, for them to know every single one of their English language learners and their English language development level, and be able to also provide them with strategies. So that will be coming in the next couple of weeks, early in the next few months. Parent engagement, we're really excited that for the first time we will have PIQE, which stands for Parent Institute for Quality Education, and we will be beginning with 2 of our sites, hopefully adding more as the organization is able to provide support for us. So we will definitely be working with our families to ensure that they're aware of this amazing opportunity, as well as really looking at what are the needs at each individual site, and ensuring that our family engagement facilitators are there to be able to support the needs of our families. Reclassification for our students that took the summative LPAC in the springtime is already happening. We are very excited that we have the results back from those students that completed that assessment in the spring. So there'll be a lot of work with regards to that. And for the sites that have 21 or more students that are English learners, we will definitely be working with those sites to ensure that we have the English Language Advisory Committee at those sites. And also we will continue to work with our DLAC group, that's the committee at the district level. So we are definitely committed. Every single one of our services, it will be available to our students, and we will definitely be working with sites to identify if there's any needs and ensure that we have the resources to be able to support our English language learners as they return back to school. So thank you very much. I turn it back to you, Dr. Armstrong.
Great, thank you. And Executive Director Steve Mazzara.
Thank you. I'm going to say a quick word about independent study and our special services. Students with IEPs are eligible for independent study. It is a team decision, meaning the IEP team must come together. They must look at the goals and services for the child, make individual decisions. In most cases, most likelihood, mild to moderate. You may know that more as like an RSP or an SDC student. They should be able to go into an independent study program effectively. We will have credentialed as educational specialist who will be supporting them in an independent study model, meeting what's called their SAI, Specialized Academic Instructional Minutes, and speech and language and other services. We will be able to gear up and do those remotely or in person, depending on the needs of the family. So we do think we're going to be able to do that. We may not be able to cover all students with IEPs, depending on the medical needs or the severity of the disability. So that again is going to be an individual IEP decision. So the process would be the family would request independent study, and then we will then notify their case manager who will establish an IEP meeting. And then there is a 30-day window for IEP meetings to be held and get that established. That's a little bit different than the 15 days for the independent study for general education. Dr. Armstrong, back to you.
Perfect, thank you. And so the last thing that I wanted to emphasize with AB 104 is that there's two other parts. The second part is student retention for 21-22. And student retention means keeping a student in the same grade level for another year. So families of students who had students enrolled in kindergarten through 11th grade during the 2021 academic year, so last school year, who received deficient grades for at least half of their coursework may provide a written request to the school for a meeting so that you may discuss retention for the 21-22 school year. So that means having that student repeat that same grade level for the 21-22 school year. And that will require a meeting with school staff. And then the last part is the graduation requirements part, which is students enrolled in their third or fourth year of high school. So juniors and seniors last year, juniors and seniors who are not on track to graduate in 4 years, or seniors who didn't complete the graduation requirements will be given the opportunity to complete the state graduation requirements to graduate. And so those are two other important updates. And again, this information is on the website, and we will also be sending out other communication. Thank you.
If it's okay, Dr. Armstrong, I wanted to mention one thing one more time. Is that all right?
Yes, absolutely.
Thank you. We have a lot of information for you tonight, and other departments will speak at length here in just a minute. But I just wanted to remind everyone, just in case you weren't clear, because there's just a lot of information returning to school with our situation as it is with the pandemic. On our website, srcsschools.org/AB130, the actual form is linked. So you can go there, you can click on the form, and you can fill it out showing that you have an interest in independent study, and Santa Rosa City Schools will be following up. So please do know that you can actually indicate your interest there should you want to do so. Thank you.
Thank you, Tim. I'll now pass it over to Mike Shepard, Assistant Superintendent of Human Resources.
Thank you, and good evening, Santa Rosa City Schools community. I'd like to introduce again Steve Mazzara, Executive Director of Special Services, and Patty Turner, Director of Risk Management and Safety. They're going to present some latest updates to safety guidelines for students and staff.
Thank you very much. I'll go through some highlights from the California Public Health. Please, we'll try to answer questions in there, and we'll try to go to maybe just the relevant, important pieces I think families may be looking after. To start off with, screeners such as a temperature check or a daily screener through Parent Square are not required. Masks are required on campus at all times indoors. In an outside setting such as recess or physical education classes, the masks are not required. Distancing requirements are not labeled per se. We will be spaced as much as possible in a physical classroom. You can anticipate, however, a secondary classroom that might have 32 students in it the students will be distanced differently than students that have 20 students in it. Increased ventilation requirements remain, hand sanitation, sanitizing of the room are very similar to everything that we did in the spring. There are no major changes to that. Another major change to make you aware of is about vaccinations and quarantines. Vaccinations are not required by the state nor Santa Rosa City Schools to attend. If there is a case in a classroom where there is a child that does come up with a positive COVID report, the child is obviously sent home immediately. However, in this year's version from California Public Health, they're creating what they're called a modified modified quarantine, which means as long as other protocols were in place in the room, ventilation, masking, spacing as much as possible, the other students in the room who do not show symptoms will be able to continue in the room. What has to happen is the district must do testing, or the child must receive testing twice per week for those 10 days of that period of time. In our case, we will bring to this classroom the nose swab type of testing. Our team will do the testing during that class time to make sure they go through that testing. We will notify families if a positive comes back. If a family does not want to use our swabbing procedure and would rather use their healthcare or one of the existing county sites, they will do that. They can stay in the class as long as they show proof that they have an appointment or they have involved or have gotten involved in that. And that allows children to stay in the classroom, the adults to stay with the classroom as long as possible. And that's one of the major changes that we're looking at this year that would impact families. In terms of parents and visitors on campus, as long as everyone is masked and spaced as much as possible, we're doing that. We're trying to modify things as much as possible, but there are no family restrictions per se that are given from county health guidelines. And so if there's a sporting event, as an example, we're going to do everything we can to distance, to make sure everyone is masked coming on campuses, but there are not vaccination requirements for family members. There's only the masking requirements. Patty, are there other things you could tag team on that I may have forgotten?
No, I think you pretty much hit the main points. Yes. Thank you.
And so otherwise, again, I'm kind of comparing things to spring. If you were in person spring, we don't have the staggered start times. We don't have cohorts that are necessary. We're going to do everything we can to obviously keep students apart, but we don't have the mandates for things like bell schedules and cohorts and the blues and reds and yellows and all those cohorts that were there. So it is obviously a way to try to get students back in class, get instruction happening in person in the safest way the current guidelines give us. There'll be more questions later in the presentation, as Anna Trinell has mentioned, about the physicians that'll be on. But in terms of the guidelines and the basic things from families, that's kind of where we are at this point. Back to you, Superintendent Trinell. Or Dr. Armstrong, I apologize.
Actually, I'm going to jump in again. I have just a couple of brief updates from HR, just letting the community know that we have hired all of our site leaders, and they are very excited to be welcoming students back next week. And we are very diligently working to fill all of our teacher education classified positions. As we know, that's very important. And also, I want to make all of you aware of some upcoming, we're calling them pop-up clinics that we're partnering with the Sonoma County Department of Health. And so locally, we have 3 clinics coming up. Pioneer High School, August 7th, 12:30 to 6:30 p.m. And again at Pioneer, August 28th, 12:30 to 6:30 p.m. And by the way, we will put this information out so you don't have to furiously take notes right now. Cesar Chavez Language Academy, August 10th from 9 a.m. to 3 p.m. And Santa Rosa High, August 11th, 9 a.m. to 3 p.m. And there are also 4 other locations in the region. Mark West Elementary School, that's tomorrow, August 5th, from 3 to 6:30 p.m. Calmacac Language Academy, August 5th, 5 to 7 p.m. and August 6th, 2 to 4 p.m. Cloverdale High School, August 9th, 12 to 6:30 p.m. and Adele Harrison Middle School, August 11th, 11 to 3 p.m. And I will now turn it back over to Superintendent Trinnell.
Thank you so much, Mike. I just want to recognize that we are answering questions that are coming through in the Q&A. So please continue to ask those. And I would also like to recognize Dr. Protowski, who has joined us, as well as Dr. Jimenez. And if you don't mind just taking a moment to introduce yourself. And we are very appreciative to have you here tonight.
Thank you so much, Supervisor Trinnell. I'm Dr. Brian Prostowski. I'm a pediatrician. I work for Sutter, and trying to keep up with Dr. Mazzara's explanation about all the rules. To be honest, I think we tend to simplify it a little bit more. You guys are being very specific and very appropriately specific to make sure that everybody knows exactly what the rules are. In general, I think over the last year, we've learned quite a bit about navigating coronavirus. And I have one of my colleagues with me here, Dr. Douglas Jimenez, who is a really well-respected family doctor in our community, to weigh in as well. But with regard to a few things that we've learned that have been consistent amongst all of the variants are that masks really work, whether you're indoors or outdoors. Outdoors, it seems much less likely to transmit or contract coronavirus, which is why masks indoors are essential. And as you mentioned, the appropriate ventilation, which sort of is similar to the indoor and outdoor spacing. And then doing the best you can with spacing and hand sanitizers. I think that over the last year, before we had access to the vaccine, which is for many children who are under 12 years old, still the reality. So we've learned that those public health maneuvers work. And it's so reassuring as a pediatrician in our community. And I could speak for my colleague, and hopefully he can weigh in here as well, that a lot of us in healthcare are pretty scared about this and really appreciate a conservative approach as much as possible. And I think before I hand it over to Dr. Jimenez to say something too, I generally tend to not make any recommendations solo, because science is a collaborative process. And so I tend to follow the governing bodies that give us these recommendations. So the American Academy of Pediatrics has said that in general, as you started, Supervisor, with saying that this is student-centered and student-focused with a full-time return to school, the American Academy of Pediatrics has said we need to prioritize getting children back to schools alongside their friends and teachers. And we all play a role in making sure it happens safely. And they said that they recommend universal masking. This is they, meaning the whole group of national pediatricians that are the people who kind of guide me, has said a significant portion of the student population is not yet eligible for vaccines. And masking is proven to reduce transmission of the virus and protect those who are not vaccinated. Dr. Jimenez, I appreciate you being here as a trusted member in our community, not only for, he's worked for Santa Rosa Community Health for over 20 years. He, like me, is also a teacher, not a doctor of education, but we're teachers of medicine. Do you have anything else that you feel like would be helpful to add to try to support what these guys in Santa Rosa City Schools are working so hard to create for our students?
Yeah, thank you for that. Only to add on top of what you said, Dr. Prostowski, and kind of what everyone else is saying, we know what works. We have really good ideas of what makes the difference, but everyone is beginning to experience the fatigue of this long drawn out pandemic. And I think 1 to 2 months ago, we got a little bit of a window of what life was going to be like after the pandemic. And everybody began to relax very quickly in terms of the procedures that we've been doing for the last year and a half that have been really impactful and have made a difference. And what's been the result of that reduction in our vigilance, right? We are seeing a huge upticks in cases of coronavirus, of COVID disease here in Sonoma County and nationally. And so we really gotta, this is a plea, this my part is my plea to everyone on this call, to the parents out there, to the parents of children, to stay vigilant. These practices work, we just gotta keep doing them and we'll get to the other side someday. But in the meantime, as you're getting your students ready to go back to school, talk to your kids. You gotta wear your mask, you gotta keep your distance, you gotta keep doing all those things. And if they hear that message at home over and over again, they're going to be much more effective at doing it when they get to school, when they start hearing it from their teachers as well. So that's my plea to everybody. So thank you for hearing me on that.
And I did see a question in the chat. I know it's difficult to keep up. You guys, there are so many questions. I'm not sure how you do this. But there was a question from Melissa who had said, why is there no requirement for distancing outside? And it's interesting because it's sort of, I think in many ways what Dr. Mazzara was saying about ventilation, and there's a sort of dilutional effect. So it's sort of, you might think about it like the concentration of the exposure, which is why everybody is mostly focused on indoor exposures. So for the most part, particularly with outdoor sports and camps over the summer, we want our kids to engage, and the chance of contracting coronavirus outside is significantly less likely than inside. I see that my other colleague who I invited to this meeting, if it's okay, Supervisor, to just introduce her. Dr. Devon Jackson is another one of our very well-respected family doctors in our community, and I see her joining the panel here. Dr. Jackson, thank you so much for joining us on short notice. And we're basically just, Dr. Jimenez and Dr. Jackson and I have worked together for years. And we're doing everything we can at this point to try to be as supportive of parents, as supportive of children, and just keep people from getting sick. So Dr. Jackson, thank you so much for joining.
Thank you, Dr. Jackson. Appreciate you being here.
Thank you for having me.
Any other information that you'd like to share in addition to what Dr. Is it Pristowski? I believe I pronounced your name incorrectly before. I apologize. And Dr. Jimenez have already shared?
I am sorry, because of my work schedule, I was just able to join. Okay. So I did not have the opportunity to hear everything that they shared. But if I could add this one principle, they may have covered it. And that is to the point that Doug Jimenez was making, that because of the length of the pandemic, we can become lax in things that have been shown to make a difference. And particularly when it comes to children, our goal is prevention of exposure. So this is where those behavioral elements, as opposed to the medical element having to do with vaccination, the social distancing, the hand washing, the use of masks, and of course, using masks correctly, covering nose and mouth, and doing so diligently, those things make such a difference. Thank you.
Thank you so much. Okay, I'm gonna now hand it over to Deputy Superintendent Rick Edson.
Good evening, everyone. Again, a couple of updates on several different areas, including meal services and the transition to Aries, which I have seen a couple of questions that have been asked in the Q&A. I just want to let everyone know that we still do have an adequate and substantial amount of PPE, both at the sites and in the warehouse, ready for distribution as needed, including face coverings or masks, sanitizer, wipes, cleaning supplies for our custodial staff for use at the sites, as well as hand washing stations will still be available predominantly at the middle and high schools where majority of rooms don't have sinks. And then still a few at elementary school sites where the majority of rooms do have sinks. We're continuing to monitor our supply and acquiring more as needed, as with demonstrated use based on the spring, and then we'll be closely monitoring going through the first 3 weeks, ensuring that we have enough on hand for the remainder of the school year. With that, I'm going to ask Director Burke to speak about child nutrition services and meals going into the 21-22 school year.
All righty, thank you very much. I would like to start with a very jubilant note. The USDA has authorized us to offer free meals to all students throughout the entire school year. There is no need to do a meal application. There's no barriers. Just show up, grab a meal, and as Dr. Burkowski and Steve Mazzara were discussing, let's eat outside. Socially distanced, lots more ventilation. I am seeing a lot of those questions. Please feel free to ask more as we go. So everyone eats for free. This is amazing. This is great. We love this. The next step is, in place of meal applications, which have historically been a barrier, we are asking folks to fill out an income survey form as part of their registration process. It's 2 questions. It's 2 questions and you're done. It is the easiest way to secure funding for our schools, and it will be really helpful if everyone fills one out. So we would encourage you, please fill one out. And the reason that we do that is this helps us secure school funding that would otherwise be accounted for with meal applications. So please fill out an income survey form. You are also welcome to fill out a traditional meal app if you feel more comfortable. They are online at family.titank12.com. That's Titan family, family.titank12.com. Or you can always pick up a paper application at your child's school site by request. We would encourage you, please fill it out online so that there's a greater amount of social distancing. And we would love to hear from you. So thank you very much. And I will be answering questions in the chat. Please feel free to direct any questions about mealtime or meal service, and we'd be happy to help. Thank you very much.
Thank you, Director Burke. Moving on, wanted to let everyone know that busing is back to, I'll say normal in terms of providing bus service to schools. Routes times were posted on the West County Transportation Agency website this week at www.schoolbusing.org, where you can see routes for those schools that receive bus service. Requirements for riding the bus still include masking, and they will be making adjustments to routes and maybe minor adjustment to pick up and drop off times over the first couple of weeks when they see ridership. Information will continue to be sent out about that as it becomes available to us. I'd also like to mention Santa Rosa City Bus is offering free rides to all students of any age range. Information can be found on their website. This is an 18-month pilot program that is fully funded, where the city will look at ridership and use and how it's affecting, positively affecting resources within the city, but that is available to all students TK through 12. With that, I will ask Director Van Dyke to speak about the implementation of Aries, timelines for parents to get information and what it means as we're starting the new school year.
Thank you, Deputy Edson. So I've added a couple of things based on what I've seen come across on questions. So our Aries implementation has been as follows. This summer, we did our final migration of data from the former platform Illuminate into Aries. We've been working since that final migration to finish setup issues, correct errors and whatnot, that kind of stuff. The new system will house all information related to students that includes grades, transcripts, enrollment, schedules, attendance, that other kind of required information. For our elementary students, we will continue to use the Illuminate platform for the report card. Parents will continue to have access in Illuminate, and they will access a new portal, the Aries Parent Portal. Information on that will be coming shortly, but in order to access the Aries Parent Portal, you will need an email address, an access code, which we are going to be sending to you. And we will package up and send to you by Sunday evening the information you need to activate your Aries portal. I mentioned Parent Square. Parent Square is our communication system. Parent Square can work on your smartphone. It can work on your computer. It can work on a tablet device. You can use text messaging only. You can do it by email only. And we do want to have a phone number. That's how we're going to message you for general information, posts, simple kind of stuff. One of the questions I saw come across a lot was, when are we going to hear information on orientation? Your school sites will be sending that information out via Parent Square. If you don't have an active Parent Square account, you will be receiving an invitation in email or text, maybe both, depending on what information we have for you. And that will be coming out Sunday as well in connection with our messaging for your Aries portal. And that covers the basics. Mr. Edson, anything that you would like me to add?
Not at this point. Thank you, Rand. My last point to speak about, as part of the process that we started last year in going through winter and spring, we did create the COVID safety plan. We are in the process of updating that plan with information from the CDC, CDPH, and the Sonoma County Department of Health Services. This is going to be a process where we will schedule opportunities for parents in the community to weigh in on the plan and hear about that through another forum event similar to this one. And a date for that will be coming out next week to provide input to our updated COVID safety plan as we move into the fall. So look for information next week on that. And with that, I'll turn it over to Superintendent Trudeau.
Thank you, Rick. We have lots of great questions coming in. That concludes the main talking points for tonight. I wondered if we could take an opportunity now to bring over some folks who have their hands raised and to hear some of the questions coming from our community. We'll start with, I'm doing Adina's job, sorry. I'll hand it back over to you, Adina, to assist us with that.
No worries. So our first call is from Auralia Vera. So I'm going to go ahead and allow them to speak. Oh, it looks like, okay, here we go.
Hello, Auralia. Thank you for joining us tonight. Do you have a question?
Aurelia, could you please go ahead and unmute yourself if you're there?
I'm here. Yeah, no, did I say I have a question? Sorry,
yeah, your hand is raised.
Oh no, I pressed it because I thought I could get translator since the meeting started. So, but I just catch whatever I could. Thank you anyway for asking.
Thank you,
Aurelia. If you are needing translation, you can click the globe at the bottom and that will put you into the channel for translation.
Okay. Yeah, it didn't hear everything, like a stop of mute, whoever person was saying the instructions how to get the translator, but I think I catch them pretty important things. Thank you.
Thank you. Okay, our next speaker is Xavier. Xavier, if you're with us, could you please go ahead and unmute?
Maybe we can come back to Xavier.
Yes. Our next speaker is Rosa. Alto Murano. And Rosa's device will only allow me to promote her as a panelist. Is that okay?
Sure.
Hi, Rosa. Could you please go ahead and unmute yourself?
Did I did it? Can you hear?
We can hear you. Uh-oh. Rosa, I'm sorry, we're having a hard time hearing.
Ya no escucho.
We can hear you now.
You can hear me? Thank you. Okay, I have a question. So since last year, I have 2 boys, and the 2 boys did not did the work online. And so I'm wondering if they go back and then they ended up not going back. They stay home, but they don't do the Zoom work. So what's going to happen?
I'll hand that over to Dr. Armstrong and your team.
Yeah, absolutely. Thank you. Thank you, Rosa. So you're saying if your students choose an independent study option, not go back to the classroom, and they are still not experiencing success, what the next move would be? I mean, my immediate answer would be to sit down with the team so that we can take a look at what's happening and see what supports we have in place for students. I think that would be our response to any student that's struggling. And so I think we would just want to sit down and have a conversation with you and your students so that we can create a plan so that they can experience success.
Okay, so how can I find out since one of them is going to be graduating, and how can I find out if he's going to be able to graduate or not?
Right. So I would say to definitely reach out to your school and the counseling department. I would say start there to have a conversation because as we had mentioned earlier with AB 104, there is some language that supports last year's 11th and 12th graders, which sounds like that would apply to your student. And there are some graduation options that we'll have to help your students get to where they need to be. So if you want, feel free to send me an email and I can help connect you to the appropriate person. My email is karmstrong@srcs.
Okay, 1 second, give me a second.
Oh, okay.
Kimberly, maybe you can put it in the chat for her.
Okay.
Okay, I'm ready.
Okay, K Armstrong.
K Armstrong.
Yes, at SRCS.
SRCS.
K12.
K12.
.ca.us.
Oh, okay, got it.
Okay.
All right, well, thank you, appreciate it.
Thank you. Should we try Xavier again?
Yes, sir. Xavier, if you're with us, could you please go ahead and unmute? It doesn't look like Xavier is there. Xavier, I'm going to go ahead and move you back as an attendee. And if you would like to ask a question, you can go ahead and raise your hand or enter your question in the Q&A section below. Okay, our next attendee is Jeanette Moe. Jeanette, if you're with us this evening, could you go ahead and unmute, please?
I'm sorry, I didn't realize my hand was up. So sorry.
That's okay. Thank you, Jeanette.
Thank you for attending, Jeanette.
Okay. Our next attendee is Kayla and April.
Hello. Can you hear me?
Yes.
Oh, so I do have three kids that are in school right now, and I didn't get information off Kayla's school. I mean Isabel's school, and she is in Steel Lane Elementary. And I guess they told me she's still gonna be in preschool from last year. So I have no information about pretty much when she starts school, the time, and who her teacher is. And I do want her, all my kids, I want them to be back in school in person. So how do I get information with Isabel? And she goes to Steel Lane Elementary. There's no email or anything that got sent to me for her.
Adina, if you move, I'm sorry, what is your name, miss?
Oh, I'm the mom. So April Cabosi.
Okay, April, thank you. Adina, if you move April back, are you able to communicate with her where we could get her contact information?
Yes, we can communicate through the chat.
Okay, April, let's do that, and then we can follow up and get you connected, okay?
Okay, so what do I do?
So Adina's gonna follow up with you in the chat in Zoom right now. And if you could share with her your contact information, then we will absolutely have the school follow up with you.
Okay, so how do I start that right now? Just go to.
So Adina's going to move you back. She's going to move you out of the space and she'll connect with you right now via chat.
Okay, so just wait.
Thank you, April, for attending tonight.
Thank you.
Superintendent Trinnell, I've actually seen that question a number of times in the chat, and I'm reminding people that they will be getting a message through Parent Square, even if they've never activated their account, they will still get that message based on the information we have in the system. So it's also possible a particular school site hasn't sent anything yet.
Thank you, Rand. Appreciate that, especially since we are experiencing the transition to the new system. Sites needed to wait for that transition to happen before they could start sending communications. Thank you for that reminder.
You're welcome.
Our next attendee is Corey Hibden.
Hi. Can you hear me?
Hi, Corey.
Okay. I have two questions. First question is, I understand that the kids are all getting free meals, but can they bring their own lunch?
Yes, they can.
Okay. And the second question is if our daughters, they're going back to school, but if they don't feel comfortable doing it, can they go back onto Zoom?
I'm going to hand that question over to Dr. Armstrong.
Yeah, thank you. So the option would be independent study. I know traditionally, or I guess last year, I should say, there was an option for students to Zoom and be able to Zoom into classrooms. Independent study is pretty much as it says, it's independent study with some live instructional time, but definitely not a full day's worth. And so, yeah, at any point, a family can request to go into independent study, even if they start attending classes on a regular bell schedule or regular classroom. And this is for all grades, kindergarten through 12th grade. So they can start off in a regular classroom and then bounce back to independent study and then bounce back.
Okay. And I do have another question. How do I get my daughter what is that called? An IEP request or a request for an IEP?
Thank you, Corey. I'm going to hand that over to Steve Mazzara.
Hi, that starts with the principal, the administrator at the school site, who acts as a hub to coordinate the various specialists within the timelines that we required under federal law. So you'd start with a request in writing, or I would encourage a conversation first perhaps with the principal or administrator about, what's going on, why do you think that? And then they go from there.
Well, I have asked the counselor about when I go, my daughter has dyslexic, and she said that she needed a new evaluation, but I don't understand why she would need a new evaluation.
It kind of depends on the case. So let's take this offline. I'll put my contact, or Adina, can you get Ms. Hibden my contact, and I can give her more information.
Okay, that would be great. Thank you.
You bet.
Thank you for attending tonight, Corey.
Oh, you're welcome.
Our next speaker is Fernando.
Just hi, good evening. I was gonna ask you about what was commented as the procedure if there's an outbreak in the classroom. If I heard correctly, maybe I didn't, the procedure would be to separate the child who's experiencing symptoms from the herd, and then others who do not display symptoms remain in the classroom. My question, and I did post it in the chat, is if as a parent, as I don't feel comfortable with that, and I do not, leaving my child, whether he was exposed last week or last day, which is, as I understand, the guidelines for county right now, can I choose to have my child isolated at that time? How would you communicate that to me as a parent before you conduct any testing on them?
What we'll do is if there's a general notification that will happen. So if classroom 12 had a child test positive in that classroom, the entire school will get a blanket notice that there was a positive case. They'll ask you to please make sure you check with your son or daughter for symptoms. They'll have a list of places where you can be testing if you're not familiar with it, with testing procedures. If it's in the classroom where your child happens to be in that room 12 as an example, there will be a separate letter that says your child has been identified as a close contact. However, you can remain in the classroom as long as you provide testing. We will provide testing within 24 hours, or you could choose to do it. So you always have that ability to stay home, request work for that 10-day quarantine period to be safe. We would encourage you to access our testing or your own personal testing just to make sure during that time, but you will not be required to stay in class. You're welcome to come home, stay home, ask the teacher for work, and quarantine as well.
And that initial communication, you say, will be by letter or by email to the parent?
I don't know if we're going to put that on US Mail or use Parent Square. Currently, we're using Parent Square for our communication at the school sites and classrooms.
Thank you.
Welcome.
Thank you, Fernando.
Our next speaker is Anna. And Anna will be joining us as a panelist.
Hi, my question was already answered prior, just about how classes are going to be online or on Zoom, or if they was explained that it was independent study was. So my question was, so that the students wouldn't have any contact with other students in the classroom if they're independent study. And yeah, that was one of my questions.
Okay, thank you so much.
Our next speaker, could you please announce your name? I have you listed as HTOO.
Oh yeah, two Farah. HTOO2.
Two. Welcome to. Thank you for being here.
Yeah, I have a question for my son went back to school, so the school class like a limit, right? So how am I supposed to register to my son come to the school?
Let's see, who will take that question for registration?
I will drop the registration link into the chat for everyone, and you'll be able to click on that link. It'll take you right to the form to get that process started.
Okay. So you're gonna send it to email, or where you want me to write it down?
I will put it in the chat so that you can just click on it right here, right now.
Oh, so that's the way we're gonna register on it?
Yep, it'll take you right to the form and you can complete that and it'll go right to your school.
Oh, okay.
Thank you, Rand.
Where's the chat? I think.
At the bottom, there's a feature, it says chat.
Oh, okay. Okay.
Click on that and then you will see information from Rand.
Yeah. Okay.
I think he's working on putting it in the chat right now.
Okay. I didn't see like a website on it. Registration.
There it is.
Oh, okay. So I gotta go to that one, go to registration.
Yes.
Is it right? And then make sure, how did I know we registration like already? We just call you back, or?
Rand, if a parent has already registered, how would they know?
What they can do is contact the school site. I'll drop the link into our list of schools and reach out to the, is it a elementary, middle, or high school?
High school.
High school. So I'll tell you, I'll package it all up in a little message with a link to the school sites, and you can just send an email to them. They've been working on those the last couple of days. As Mr. Nell had mentioned earlier, we just finished getting Aries and the registration piece up and running. So I know that the sites have been doing that.
Okay.
I'll give you an email address that you can send an email to, and they'll help you. They'll find your registration and make sure that you're ready to go.
So do you have a phone number? Some, just in case.
There'll be a phone number as well. You can use the phone. I highly encourage you to email if you have an email address. It will help them keep track of what they're doing.
Okay.
It's going to take me a couple minutes to write all that up, and then I'll drop it in the chat.
Okay. Thank you so much. And then my son, I have a question. The last question. My son have a 9th grade, like a distant learning, like a last year, and then somebody called me. They didn't pass it, graduated. So my son go to summer school, and then now I just want to know he gonna pass like a 9th grade or he doesn't pass. How am I supposed to check like a?
Dr. Armstrong, can I have someone from your team respond?
Yeah, how about Tim? Do you want to take that one? Thank you.
Of course. Good evening, sir.
Yeah, good evening. How are you, sir?
I'm doing well, thank you. You? I'm doing well, thank you. I hope you're doing well.
Yeah.
So for summer school,
yes,
students should receive information regarding their performance. If for any reason that information is not something that you easily have at hand, you may contact the school site, and your school site will have the academic record for your student. And you will know how they did academically. Typically, Santa Rosa City Schools wants students to move forward with their class and does not seek to hold them back. But you can find out the academic score by either A, looking at the information shared with you, or checking in with the school site.
Okay.
I hope that was helpful.
Okay, thank you. Yes.
You're very welcome. Have a nice evening.
You too. Thank you.
Thank you.
So
our next speaker is Augustina. Augustina, if you're with us, could you please unmute? Augustina, are you here with us? It doesn't look like Augustina's present, so I'm going to go ahead and lower your hand at this time. And if you would like to ask a question, please go ahead and raise your hand once again. And our next speaker is Ashley Bell.
Hi, my question pertains to a positive COVID test. It was mentioned earlier that a blanket notification would go out to a school site, but how is Santa Rosa City Schools defining close contact? Last spring, it was defined as within 6 feet, and since our desks were more than 6 feet apart, a positive case in a classroom wasn't necessarily notified to everybody who was in that classroom. So I'm just curious as to who is going to be considered a close contact this year and who will be notified when a student tests positive.
Thank you.
I'll take that. In a conversation with Public Health this afternoon, we clarified that. And, primarily in the setting of a classroom, it would be the students in the classroom that could be identified that the classroom, that a student was there. And so to be cautious, while they're allowing them to stay in place, that's when they're going to do the testing rather than send everybody home to do the COVID test. They're going to keep everyone in place. That feels natural to them. We will also, though, students could have participation in other classes, like at secondary and be in multiple classes. They could be participating in sports or extracurriculars. And so we have to do the contact tracing with that individual to identify who were they around in those other settings. But the information they gave us today was primarily in a classroom that would likely be considered close contact. The letter would go out specifically to that classroom, and then we'd want to test in that classroom for those 2 weeks.
So to clarify, every student in the class who shares a classroom with that student, so a secondary student, all 6 classes, every student they share a class with, every teacher who teaches them will all be notified if and when a student tests positive.
They will be notified that there was a positive in that classroom. Whether or not they're notified as a close contact will be different depending on the student. Like literally, if the student stayed in their desk the entire time in history and did not come near anybody else, they will not be identified.
So even if there's 40 people in the classroom, if they didn't get up during the 80-minute block, no one in that classroom would be notified.
I can't say no one. That's what Public Health is telling us. We have to review those close contacts with Public Health. They ask us questions. They ask us about movement. They ask us about room ventilation and size. And so every case would be different. So they're not making a blanket rule. We have to go through that process to identify who really was at risk. And we're masked.
So there will not, if your child is in a classroom with another child and that other child tests positive, there is no guarantee that you will know as a parent.
No, you will absolutely know in a blanket to everyone on site. You will not be identified specifically for testing unless your child was deemed a close contact. 2 different letters.
Some of our school sites have like thousands of people on them.
So
that means you have no idea if you were in a classroom with another student or your child was in a classroom with another student necessarily.
No, we would go through the process to identify a close contact. If your child was not identified as a close contact, you would not get the second letter.
Okay, and a close contact is defined as within 6 feet for 15 minutes without a mask or with a mask?
That's currently how CDPH is defining it. We've had instances where Sonoma County Health takes a little different angle on it and they work with them. And so that's generally the guideline, 6 feet within 15 minutes within a 24-hour period.
Okay, thank you.
And our next caller, it looks like we have Moto G7 Supra. Could you please state your name? Caller, I have you listed as Moto G7 Supra. Could you please go ahead and unmute and state your name? Moto G7 Supra, I'm going to go ahead and lower your hand at this time. If you would like to ask a question, please go ahead and raise your hand once again. Our next speaker is Alex Moore.
Can you hear me?
Yes.
Hi, thank you for taking my question. My son is going to be in 8th grade, and we are interested in doing independent study because of COVID risks for his health. And I have looked at the Santa Rosa City School webpage for independent study and read everything I could find about independent study, and it's very murky and unclear. So I'm hoping you guys can give me some guidance on this. I would like to understand who his teachers will be for independent study. He has 6 classes. One of them is advanced math. Would he be able to take advanced math under independent study? How do grades work? Can he keep his laptop from the Santa Rosa City Schools? Do we get books? I have literally no prior knowledge of independent study. So any new information is greatly appreciated. School is supposed to start in 8 days, and we feel like we're kind of afloat here.
Thank you for the questions, and I will hand it over to Dr. Armstrong and her team.
Yeah, great. Thank you for the question. So we will be getting information out via Parent Square on the process and the procedures and what school will look like exactly. Just to maybe bring a little bit more context into the conversation, because independent study will be individualized based on the student and their needs towards the general education requirements, we'll need to tailor that way. And so one of the reasons why we have launched the interest form tonight is so that we can understand the number of students and families that are requesting this option, so that we can begin to plan to put students where they need to be. And so I can absolutely guarantee that we'll have all the resources and supports and schedule put in place come the first day of school. And I think we'll have to engage in a couple of more conversations as we learn more, as the guidelines shift, and we need to be responsive to those guidelines. So I guess the best advice that I would give is to be patient a couple of more days, look at the information that comes out via Parent Square, and then there'll be information for you to access to contact the Ed Services Department.
So this will be all us dealing with the district, not us dealing with his school that he's registered at right now. That's correct?
Well, it'll be a little bit of both, but I will say, I think my understanding as I've been watching chat, I think that there is maybe a belief for some people that independent study may mean that students are able to access the courses that, let's say, what's already on their schedule, and maybe have access to those teachers. And that's simply not the case. You know, we have an online provider right now who has been handling the learning management for students accessing courses online. And so that'll be the primary method. So all courses that are typical general education courses and some that need to be specialized will be available. But I just want to make sure that families aren't picturing that schedule that students typically receive with the teachers that are in that building as teachers that will be there for the independent study for the courses. It will be using an online learning management system.
Okay. Will he get to keep the laptop that was issued to him by the Santa Rosa City Schools for this year?
Yes, so he is still a Santa Rosa City School student, and any activities, I saw a question in the chat asking about students who are wanting to access activities or athletics for their homeschool. I mean, that's still an option and available and possible. It's just that we need to reimagine independent study and maybe dismiss distance learning in the way that we knew it during the COVID year, because independent study will be different. And so
Is there any in-person interaction required with independent study, or can it all be done virtually due to health issues?
Yeah, so it will all be done virtually. There are some times where that student, your student or any other student will be able to access their teacher of record. And that may be for instruction, depending on the grade level. It could be for support, it could be for monitoring, it could be checking in and making sure that they're navigating the courses that they're assigned. So it can look very different, and it's, you know, individualized for the student.
And would he receive regular grades, and how would then fold once hopefully COVID goes away soon? Once the pandemic finishes, how do you fold him back into the system?
Yeah, that's a great question. And yes, the grading will be similar to his home high school. And the wonderful thing about independent study and the access that it's creating is that students, as their situation changes, are able to go back into their regular school, their home school, and pick up the classes, be enrolled in the classes that they had for independent study. I mean, I just want to maybe put a little bit of an asterisk and say that sometimes there's courses that a student may access online, and when getting back in their class, I mean, I don't want to overcommit, because there could be a class that's full, or maybe it's a specialized course that's not offered. I mean, there'll be opportunities for a student to complete the course that they have, but then also access what's needed at their home high school.
Okay, well, and then from your previous conversation, I understand that as once we fill out the form for independent study, somebody from the district will contact us personally within 15 days. Is my understanding correct?
Is that for the grade change or for independent study?
For independent study.
Oh, it'll be sooner. Yes, it'll definitely be sooner than 15 days. We're wanting to launch when school starts on August 12th. And so if that August 12th conversation is going through enrollment and orientation, then that's what it'll be. But our expectation is that all of our students are engaged in learning and orientating to their new learning environment on August 12th.
Okay, and all the communication about independent study will be done through Parent Square or a phone call to the parent?
Yes, ma'am. It'll be done via Parent Square.
Okay.
And a phone call. And if you have a text message system set up through Parent Square, we'll try and message every way that we can, including to continue to update our website.
Okay. Thank you so very much for all your answers. I appreciate it.
Oh, no problem. Thank you.
Our next speaker, and I apologize if I mispronounced your name, is Sokanthia.
Hello, my name is Kasa. I'm just using my sister's computer right now. So I have several questions, and one was returning back to the doctor. He was saying that, the science works, spacing works, mask and social distancing work. So my question is, if all that works and we understand all that work, how can we put 30 plus students in a small classroom and think that we're not going to have a COVID case?
Supervisor Trinell, is that directed? Do you think, is it okay if I try to answer that? It's a really good question. I just want to be honest. I think that some of these questions from Miss Bell, from Fabronio, and Miss Moore, there's sort of this air of fear in the air right now about a more contagious variant, and trying not to get kids to get sick. And I totally hear you as a parent. I have young kids as well that are 7 and 4. And I think that what we've learned over the last year is a few things. One, I didn't mention quite yet, but one of the reasons that we think, I did talk a little bit about viral load. And one of the reasons why we think that kids don't have severe coronavirus infections, or at least as many as adults, I'm not saying that kids don't get sick. In fact, actually, the AAP data most recently, as of June 10th, they sort of present this stuff monthly. It's like almost 14% of the cases that test positive are kids, but it's a very small proportion, significantly less than 1%. It's 0.03% of kids have really severe disease. And one of the thoughts about that, just that this might help, I'm sort of, as a pediatrician, I'm always trying to be honest, is that we think that kids don't have as much of the receptors, they call them the ACE2 receptors, to bind COVID-19. And all the vaccines, at least the Pfizer vaccine, that's the one that's eligible for kids, it's designed to identify or teach your body how to identify the spike protein that is on the outside of the coronavirus molecule. So the coronavirus, the spike protein, is what binds the receptors that are in our upper respiratory tract, in our nose and in our mouth. And if you have fewer receptors, you tend not to as easily bind as high of a viral load. And what we found is that the higher the viral load exposure, the more likely that you're going to have severe disease. And it's amazing, I'd say it's almost a miracle that kids under 18 tend not to get as high a viral load and subsequently don't tend to have as serious a disease. I'm not saying that's true for all kids, because certainly for the small proportion of kids that get sick, like a third of them end up having, this is more for teens, but functionally, I would say in an overall setting, most of the real severe cases are over 18 years old that we know for now. That's not to say that with future variants that we're not going to see changes, but with the Delta variant, Alpha, Beta, Gamma, and Delta variants, what we've seen so far is disproportionately the severe disease is seen in older folks, and we think that has to do with the ability to bind a significant amount of viral load. So the reason I'm saying that is that you're saying you have a big classroom of kids, and if they're wearing masks, this is what we've learned over the last year. Kids tend to get less severe disease compared to adults. Masks work in terms of keeping you from introducing a significant amount of viral load into your upper respiratory tract. Hand sanitizer makes it so that you don't necessarily touch something that has coronavirus, that somebody sneezes in your hand, and then you pull your mask off and wipe your nose. So you're not kind of introducing it right into your upper respiratory tract. So if you're good at wearing masks, you're good at hand sanitizer before you remove your mask, and you're under 18 years old, this is where sort of we're weighing this sort of cost benefit of the mental health issues that have plagued children over this last year that I know you guys as educators have seen just as much as I have with regard to increases in suicide attempts, increases in problems with hospitalizations associated with kids, depression, all these kinds of issues that we're trying to avoid this year by getting the kids to be in school. And I really feel, I'm just so impressed by the effort that Santa Rosa City Schools has kind of put into creating a game plan that clearly is going to be a moving target. I mean, in so many ways, one of the important parts about all this that I'm hearing loud and clear is this ongoing communication with public health and the honoring that this system that we've been, coronavirus has been a moving target. Every week we're hearing new information. For right now, the information that we have about the Delta variant is that kids don't tend to get as sick. If you wear masks and do hand hygiene, it works. And the social distancing is sort of the trifecta, if you can do it as well as possible. And I totally hear you loud and clear that if you're in a closed room, it's as a parent, I understand that's a scary situation, but functionally, there are a lot of reasons right now that having kids in school and teaching them, as Dr. Jimenez had mentioned, to wear masks as a parent and really working on that with them to make sure that they stay safe and having ongoing communication. We really want kids to be in school because the mental health and the isolation and the lack of socialization from a pediatric standpoint has been a huge detriment. And we don't want kids to fall any further behind. I hope that answers your question.
Yes, but so I have two children. One is going to Lincoln Valley Middle School, and the other one's going to Maria Carrillo. And my other question is, I forgot which school it was, but one of the schools is going to be sharing lockers, and PE. So they're going to be using lockers and PE. How does that work with the fact that there is the Delta coronavirus?
Miss, I'm so sorry. You were cutting in and out. I know that I only caught part of your question.
Yes, so my question is about the lockers, like for PE and sharing lockers. I can't remember if it's Lincoln Valley or Rio. How is that with social distancing or like not having contact?
I'm so sorry. I think you were asking about PE lockers. And
yes, yeah, and
social distancing.
Yeah, and this I think one of the school mentioned that the lockers might be shared.
Okay. Who could I get to answer that question? It really is a school's question, but we may need to get back with you on that. And it could very well be a procedure at a school site and at a particular school site and what they're going to do as far as a practice.
Okay. And then one other quick question is on the independent study. If my child does want to do independent study, does those courses transfer to like a UC or CSU system counts like an in-person classes?
I will hand that over to Tim, please.
Yes, thank you for the question and good evening. So currently, as independent study is configured, especially if there's an online provider to help with secondary level classes, those would be UC and CSU transferable and would be equivalent as what you explained if a student was attending in person. Grade will, or the final mark on the transcript will be accepted by colleges for completion of a course.
Oh, perfect, thank you.
You're welcome.
Can I make a very quick comment?
Sure.
This is to piggyback on what Dr. Bristowski said. So total respect for everything that Santa Rosa City Schools is doing to try to prevent transmission with our students going back to school. But this is a plea to the parents at home that if you're, the schools are going to do everything possible to prevent transmission, but inevitably there will be some virus movement, let's say. So for you parents at home that aren't vaccinated, this is a great opportunity for you to go and get vaccinated so that if your child unfortunately does bring the virus home, you can be protected in your own house. That's all I have to say about that. Thank you.
Panel, do we have time for one more speaker?
Yes.
Okay. Our next speaker is Ron Carter.
Hello. Can you hear me? Cool. I'm a substitute teacher working with K through 6, and we just came off the hybrid in June, by June 6th, and we're coming back now, and I'm concerned because from then to now, K through 6, they're not vaccinated. COVID-D is far more stringent, and I have, unfortunately, several friends who are vaccinated who have contracted COVID-D from being in close contact with people in different areas. So as an instructor, it was difficult to social distance with 10 to 15 students in a class. How are we going to do that with 15 to 25 or 28 students in a classroom? It's almost impossible.
Thank you for the question, Mr. Carter. Can I get Steve to start the answer to that?
Yeah, there are no guidelines from CDPH that are restricting us. There were languages.
People in hospital with COVID disease are not vaccinated. Only a very small fraction of.
Uh-oh. I think Dr. Jimenez was trying to assist.
Please.
In answering.
That's ultimately the purpose of them.
I'm sorry, Dr. Jimenez, you were partially frozen there.
Okay. Am I working again right now?
Yes, you are.
All right. Sorry about that. Well, again, this is speaks to the importance of vaccination. 90% of the people we're seeing hospitalized right now because of COVID disease are people who are unvaccinated. So you may still get sick after getting vaccinated, but it's highly unlikely that you will get a severe, let alone a fatal form of the illness. So it just speaks to this idea of the single most important thing we can do as adults, including the adult teachers out there, is to get vaccinated when you're going back into the classrooms.
And Mr. Carter, let me just add on to that, as Dr. Jimenez is saying, I think that one of the important pieces to remember here is that when you're in the classroom with these kids and I know you said the D variant, I think that one misconception, just trying to kind of separate masks, physical distancing or social distancing, and hand hygiene. Those are measures that are really trying to prevent you, and ventilation. Those are trying to prevent you from being exposed. Vaccines are your setup, as Dr. Jimenez is saying, is your internal protection to help you from getting sick.
I'm curious. I'm curious though, is that we were social distancing with the hybrid last semester. Okay. And we had no more than 10 to 12 students per class in the hybrid, with them being separated by Monday, Tuesday, Thursday, Friday. With all the kids coming back 5 days a week, you're increasing the odds of infection factorially. Correct?
Do you mind if I continue to answer that, Supervisor?
I'm just curious. I mean, what's changed?
No, Mr. Carter, you are entirely right. With a more contagious variant and more exposure, that, as Dr. Jimenez was saying, and I think Dr. Jackson initially was saying too, it just makes it that much more important to pay attention to these sort of guidelines in terms of masks, hand hygiene, and getting vaccinated as soon as you can if you aren't already vaccinated. It's really, when you talk about breakthrough infections, it's like 0.04% of the infections in California are people who have been vaccinated. And I know that you knew somebody who got tested positive for COVID, but my guess is if they got the COVID vaccine, they didn't have severe infection, but their body was able to kind of keep them from getting more severe. But I think that you're right. You're saying exactly all the things that we're all kind of like highlighting, which is all of these public health measures are essential. And when you're kind of you're setting yourself up for success as best as you can. And I think getting vaccinated, just like Dr. Jimenez said, is like absolutely number one. And all of those other things like masks and hand hygiene are going to matter so much more when, as you said, you're in a position where you might have more contacts.
Okay, thank you.
Thank you, Mr. Carter, for your questions. We want to thank everyone tonight for joining us. We will be looking for another opportunity to host another forum, as we had 1,000 people attending tonight, and we had way more people who wanted to attend. So we will continue to offer these opportunities. We will continue working on the answers to the questions that you've been thoughtfully providing to us. And we will be posting on our Facebook, on our website, the FAQs. We will also communicate when those are ready so that you can look through them at your leisure. I want to thank our special guests tonight, our doctors who are with us, and appreciate your time. And also I would like to just recognize the team here who is continuing to lift this work so that we support our students and our families. Thank you, everyone, and have a wonderful night.